Good evening, good evening, everybody. Welcome to another episode of Uncommon Sense with Jose Negron. Now, for the benefit of those of you who are not familiar with the channel or are watching this channel for the first time, excuse me, just give me a moment. I apologize. Um, for the benefit of those of you who are not familiar with the channel or watching this channel for the first time, the reason why it is called Uncommon Sense is because on this platform, we discuss everyday issues where we try to find logical solutions, but not everyone uses logic. So for that reason, it is called Uncommon Sense. I want to let everybody know that I'm currently live on YouTube, Facebook, Twitter, and Twitch. Also, I need to let everybody know that the subscriber mode has been enabled. What does that mean? That means that if you're not a subscriber and if you wish to enter a comment in the chat, you would need to subscribe to the channel. First of all, I just want to give a huge shout out to all those who have already subscribed to the channel. I apologize for the technical difficulties. It's just that my Wi-Fi decided to go crazy. So right now I'm streaming from my phone and I don't know whether people are hearing me or not. So I really appreciate all the love and support all of you have given me. I also want to give a huge shout out to all those who follow me on social media. And I also want to give a huge shout out to all those who allow me to enter into your devices. So what I'm going to ask you to do is the following. If you have not done so, I'm going to ask you to please subscribe, like, and hit the bell notification to all. So therefore, whenever I do go live, you have the opportunity to either catch it live or catch it on the playback. Okay. Now, before we get into the main topic, what we're going to do is we're going to have another episode of In My Words. Okay. Lately, we've been hearing a great deal of information regarding, well, actually not information, but a lot of noise, in regards to a woman that was hit in the face with a brick. Okay. Now, what has happened was the following. Um, there was someone that asked her for her telephone number. And what happened was she refused, and um, it is believed, okay, because we don't know all the facts. It is believed. Good evening, Christina. Thank you very much for stopping by. Now, it is believed that, excuse me, it is believed that because the lady did not want to give her telephone number to some dude, that he took a brick and hit her over the face. And then there was a bunch of guys that was there who saw the whole thing, but they didn't do anything to come to her aid. And that's caused a lot of noise here in these YouTube streets. Now, in all fairness, one thing we have to bear in mind is we don't know the full story regarding what happened. But what I can say is the following. Good evening, Donna Mono. Is the following. No one, and I repeat, no one deserves to be assaulted whether it be with a brick, whether it be with a stick, whether it be with with a weapon of any sort. Okay, no one deserves to be assaulted. Okay, unfortunately, sometimes when you have these unfortunate situations that do occur, they use these opportunities to cast all African American men as crap in a poor light. Let me make this perfectly clear. And I have said this before, and I'm going to say it again. There is good and there's bad in every community. Let me repeat it again so people understand what I'm talking about. There is good. Yes, see. Well, okay. Yeah, you know what? I haven't seen the video in TikTok. Okay, I seen the part when she was struck, after she was struck, but not before. Now, let me make this perfectly clear. Again, no one deserves to be struck or assaulted. Okay. However, what we really need to know is what happened prior to that. Now, in asking that question doesn't mean that we are in any way excusing what happened to her. Let me make it clear. No one, and again, no one deserves to be struck in the face with a brick. Okay. So hopefully there'll be more information regarding the situation. But I will say this much. It is scary when you think about it. That we're living in an age where, people can be assaulted for trivial things. Okay. So with that being said, I know that Angry Biracial has done a couple of pieces earlier today. And I think the 18th letter is scheduled to do something about it as well. So all I can say is the following. No one, and I repeat, no one deserves to be assaulted. Okay. So you just have to please bear with me. Okay. So unfortunately, okay. So with that being said, what we're going to do is we're going to go to the main topic. Okay, so as you've seen by the thumbnail, the topic for tonight is mental illness. And the reason why we are covering this topic is because, unfortunately, many people have been afflicted or will be afflicted with mental illness of one sort or another. Okay. Now, mental illness comes in many ways and in many forms. Okay. Now, unfortunately, I cannot share over my computer because basically I am using my phone. So what I'm going to do is I'm going to go and I'm going to list what are the most common forms of mental illness, which are anxiety disorder, depression, bipolar disorder, post-traumatic stress disorder, schizophrenia, eating disorders, disruptive behavior and social disorders, neural development disorders, Okay, just give me a moment. Because unfortunately, but let me just talk to you regarding something that I personally went through, which is depression. Okay. When you go through depression, I mean, you're in a state where nothing, and I repeat, nothing is able to cheer you up. Okay. You see, you don't see anything positive. Um, it can affect your eating habits. It could affect your sleep habits. Okay. I myself have gone through depression 3 times in my life. Usually, it is due to a traumatic situation, uh, whether it be a loss, whether it be a death in the family, or whether it be something to the effect of a relationship ending. Okay. Now, one of the problems when it comes to depression is that first of all, it's not a subject that's easily that can be discussed. Okay. Because unfortunately, we have certain concepts when it comes to depression. Okay. Basically, we assume that the person is crazy. Okay. The person may not be insane, but the person may be going through is a traumatic situation that happened. Okay? Now, in 2020 was a very difficult year for me, um, due to the fact that I lost my oldest sister and my mother 6 months apart. Yeah, you know what? Some people do believe that it's a myth, but that's not the case. It is a serious situation. Okay, and it needs to be treated. Okay, it needs to be treated. And part of the problem is the inability to acknowledge that you need help. Okay, but that is the key. Okay, the key is to acknowledge that you have some sort of mental disorder. Okay. Once you get to that point, then you're able to seek therapy. Okay. Now I have to seek therapy due to the fact not just the fact that I had death in the family and it was a very traumatic experience, also the fact that I had broken I became brokenhearted due to women who had broke my heart, okay, who disappointed me, okay. Now the key is to acknowledge that you need help. Just give me. Now what I'm going to do is I'm going to give you the definition of what is mental illness, and this is based on the definition of the American Psychiatric Association. Mental illnesses. Now granted, I said illnesses. Health conditions involving changes in emotion, thinking, or behavior, or a combination of them all. Okay. And there are many things, and there are many ways it could be triggered. It can be triggered through a death of a loved one. It could be triggered by disease. It could be triggered by losing a loved one. Okay. Okay, first of all, with all due respect to these individuals, unless they are a trained therapist, they are no position to say anyone is crazy. Okay, and it's a very simplistic observation. Okay, look, the fact of the matter is, and if you take a look of men and women that serve in war, and then they come back, they have many traumatic situations. First of all, because they have to. Okay. First of all, because the fact of the matter is, they have to be brutal. They have to be violent. They have to kill people because, unfortunately, it's either kill or be killed. Okay. Yes, post-traumatic, post PTSD or post-traumatic stress syndrome is a serious illness. Okay. And left untreated, that can have horrible, horrible situations. Okay. Now again, now what I'm going to do is I'm just going to talk about me. Just give me a moment because my phone. Okay. So, but I'm going to share with. Okay, I'm going to share with you. Now the fact of the matter is. Okay, excuse me. 3 times, and I repeat, 3 times in my life, I have. Okay, what's this? Okay. Okay, 3 times in my life, as I stated before, I dealt with depression. 3 times out of my life, I actually thought about taking my own life. Actually, what the word is, deleting myself. Yes, that's true. That is very true. Okay, and particularly when you take into account what happened in 2020, the fact that unfortunately so many people were unalive. Okay. Yeah, that's true. Now, what I'm going to do is just bear with me because I'm okay. I'm going to read from a website called Drug Watch called Mental Illness. Okay. Mental illness are medical conditions involving changes in behavior, thinking, or emotions that interfere with a person's ability to do daily tasks or care for themselves. Common mental health disorders include anxiety disorders and mood disorders such as depression, schizophrenia, and ADHD. Other disorders include autism, borderline personality disorder, dissociative disorders, eating disorders, and obsessive compulsory disorder, also known as OCD. People diagnosed with serious mental illness typically need a combination of medication and talk therapy to get together. Well, look, the fact of the matter is you're here, you're alive, and I don't, I think you recovered. Okay, I could be wrong. Now, here's an interesting fact. More than 46 million Americans live with mental illness. Okay, considering the population is over 300 million, so we're talking about maybe 1/6 or 1/5 of the population has some sort of mental illness. Now, there's some things we need to bear in mind. Okay, mental illness isn't the fault of the person diagnosed. It is a condition, medical problem, just like diabetes, heart disease, and also common in the United States. For some people, some symptoms of poor mental health, such as feeling lonely, being overwhelmed, or worrying, becoming more serious mental illnesses. Now, as I stated, more than 46 million Americans live with mental illness, according to the National Institute of Mental Health. That's about 1 in 5 Americans, and 1 in 24 have a serious illness. The good news is that mental illness is highly treatable. For example, more than 80% of the people with depression get better after treatment. As many as 90% of the people with panic disorders get better, according to Mental Health America. So now I'm going to be talking about anxiety disorders. Okay. These disorders are marked by severe fear or dread associated with certain situations or objects. Patients have physical reactions to these objects and situations, including rapid heartbeat and sweating. They cannot control their responses. With anxiety disorders, these feelings do not go away and can get worse. They can interfere with things like job performance, school, and relationship. These disorders include panic disorder, generalized anxiety disorder, phobias, obsessive compulsive disorder, and post-traumatic stress disorder. Okay. So now what we're going to be talking about is panic disorder. Panic disorder is an anxiety disorder marked by panic attacks. Symptoms include fast heart rate, chest pain, trouble breathing, and dizziness. Patients with panic disorder often report intense feelings of terror or impending doom associated with attacks. These attacks can happen without warning. Fear of attacks can control a person's life, even making it difficult to leave the home. The next thing I'm going to be talking about is phobias. Phobias are irrational fears. For example, agoraphobia is a fear of heights, and agoraphobia is a fear of public places. Some people have social phobias or phobias involving tunnels, highway driving, water, animals, or flying. Phobias can be treated with medication and therapy. So now we're going to get into what's called post-traumatic stress disorder. This happens to some people who experience or witness terrifying or traumatic events such as a war, a bad accident, or rape. I'm not going to say the word because I don't want to get hit by the YouTube police. PTSD is marked by flashbacks, feeling alone, sleep disorder, and angry outbursts. People with PTSD have uncontrollable thoughts and intrusive memories about the event and may avoid specific places, objects, or events that bring memories up from. PTSD is treated with medication and psychotherapy. The therapist may pursue various treatment techniques. The next topic is mood disorders. They involve changes in mood or disturbances. These typically involve depression or elation, also known as mania. These disorders are highly treatable. They include major depression and bipolar disorder. Now we're going to get into depression itself. More than 17 million Americans have at least one major depressive episode in 2018, according to the Substance Abuse and Mental Service Administration. Symptoms can persist and interfere with normal life. They include sadness, loss of interest, or pleasure in the things the patient used to enjoy. Weight loss or gain, sleeping troubles, loss of energy, feeling of worthlessness, thoughts of death or suicide. Causes can be genetic, environmental, or biochemical. For example, the COVID-19 pandemic increased global rates of anxiety and depression by 25%, according to a 2022 World Health Organization study. Treatment options include antidepressant medications and talk therapy. Well, that can cause that. Yeah. Well, that's something that anyone that's been a victim of that, people will think about in those terms. Okay. I'm glad that you thought of Weston. Now we're going to be talking about bipolar disorder. Formerly known as manic depression, bipolar disorder causes extreme emotional lows and highs, known as depression and mania, according to an article. Good evening, Irby. How are you doing tonight? Okay. In JAMA, which is JAMA, about 10 million adults and children in the U.S. have this condition. While depression has symptoms of extreme sadness and worthlessness, mania manifests an extreme elation, jumpiness, and overblown feelings of self-esteem. A person will cycle back and forth between these moods. This cycling affects the ability to perform daily tasks. The length and severity of symptoms determine whether a person has bipolar 1, bipolar 2, or cyclothea. Okay. To be perfectly honest, I never heard these terms, but okay. People with bipolar 1 have severe symptoms of mania and depression. Those with bipolar 2 have more serious bouts of depression, but a lesser form of mania. People with cyclothea have severe symptoms of depression and mania, but symptoms are more chronic in nature. Treating bipolar disorders can be tricky because traditional treatments for depressions, such as antidepressants, can worsen symptoms of mania. The most effective treatment plans include atypical antipsychotics, mood stabilizers, and psychotherapy. Okay. Also, I want to let everybody know that the link to join the panel has been pinned. Should anyone wishes to join the panel, they can do so. Okay. Also, if anyone wishes to share their own personal experience as far as dealing with mental illness, they can do so if they feel comfortable. If not, it's understandable because not everyone can discuss it. Okay. Now here's an interesting point. I might be bipolar. I have to check with a psychiatrist one of these days. I don't know. But speak with a therapist. That's my suggestion. So now we're going to be talking about schizophrenia. Schizophrenia is a mental illness that affects a person's emotions, behavior, concentration, and perception of reality. This disorder is rarer than depression or anxiety, but can be crippling. Yeah, I think you should speak to just to make sure that you get the proper diagnosis, speak to a therapist. Symptoms of disorder fall into 3 categories: positive, negative, and cognitive. Positive symptoms include movement disorders, hallucinations, or fixed false beliefs. Negative symptoms include reduced feelings of pleasure of life, reduced speaking, and difficulty beginning activities. Cognitive symptoms include trouble paying attention, problem processing information, and difficulty understanding information and using it. The main treatments for schizophrenia are antipsychotics and psychotherapy. Coordinated specialty care combines psychotherapy, medication, case management, education, family involvement, and employment services help these people live better lives. You know what? That is a good question. Unfortunately, I don't think we can fully address it. Why? I have not done the research regarding that topic. So now we're going to be talking about ADHD, which is known as attention deficit hyperactivity disorder. Now, people with this type of mental illness have symptoms of inattention, hyperactivity, and impulsivity. ADHD is usually diagnosed in children, but adults can also have the disorder. Symptoms of ADHD include trouble staying organized, trouble focusing on tasks, restlessness, forgetfulness, excessive talking, or difficult paying attention to instructions and conversations. People with ADHD may also have co-occurring disorders such as anxiety, depression, or autism spectrum disorder. For younger children, the first line of therapy should be behavior therapy, according to the American Academy of Pediatrics. This therapy teaches children how to control symptoms by changing behaviors. It is focused on positive reinforcement of good behavior and improved social skills. Other types of therapy for ADHD are cognitive behavior therapy and parental skills training. The typical medications for ADHD are called stimulants. They include drugs such as Adderall, amphetamine, and Ritalin, methylphenidate. Okay, but these should be used with caution because they are controlled substances which can be habit-forming. So now we're going to be dealing with the warning signs of mental health disorders. Major mental illness rarely appears without warning. In the early stages before a disorder is recognized, friends and family members may start to notice small changes. They may feel something is not right about their loved one's thinking, feeling, or behavior. Excuse me. According to the American Psychiatric Association, warning signs may include suicidal withdrawal or loss of interest in others, drop in functioning at school, work, or social activities. Thinking problems can be involved thinking problems which can be involve concentration, memory, or logical thought and speech. Increased sensitivity to sight, sound, smells, or touch. Lack of initiative or interest in involvement of activities. Feeling disconnected from oneself or one's surroundings. Illogical thinking, including excessive beliefs about personal abilities to understand meaning and influence events. Nervousness or fear or suspicion of others. Unusual or peculiar behavior, sleep appetite or mood changes. If a person displays several of these symptoms at once and the symptoms are interfering with the person's life, he or she should visit a mental health professional. Now I'm going to discuss the risk and the causes. A person's character flaw are not causes of mental illness, and being weak or lazy has nothing to do with it, according to the U.S. National Library of Medicine. Researchers don't know exactly what causes mental illness, but they think it's a combination of factors. Okay. The risk factors and concerns of mental health include Alcohol or substance abuse, chemical imbalances in the brain, and other biological issues, exposure to toxic chemicals or viruses in the womb, genes and family history, having cancer or other serious medical conditions, injury to the brain, social isolation, stress or a history of abuse and other neglected life experiences, especially if they happen in childhood. Okay, so the question is, can medication cause mental illness? Let's see what's being discussed. While medications don't typically cause mental illness, some drugs may cause psychiatric symptoms. This is especially true if a person suddenly develops psychiatric symptoms without prior history. Always tell your healthcare provider about all your prescriptions, all over the counter, and the list of drugs you are taking. Okay. So now we're going to be talking about psychiatric symptoms potentially caused by medication. Before we do that, let's get something to drink. Okay, the first possible symptom is agitation and psychosis, anaphylaxis and androgenic steroids, Benadryl and other antihistamines, prednisolone and other corticosteroids, agitated decongestants, Xanax, and other H2 blockers, NSAIDs, opioids, proton pump inhibitors, fluoroquinolones, skeletal muscle relaxers. The next symptom is anxiety. Anabolic androgenetic steroids, prednisone, and other corticosteroids, decongestants, ondansetron, penicillin, muscle relaxers, cyclosporin, acyclovir, dilanoxin, Yeesh. Now the next symptom is depression. You know what? I'm not gonna read it. I'm just gonna, because some of those names, I'm sorry, I cannot pronounce them. I'm not even gonna try. Now the next thing we're gonna be talking about is treating mental illness. Most mental illness can be treated in an effective way, especially with early diagnosis. Treatment options include psychotherapy, medication, and learning skills to manage symptoms. With effective treatment, people with mental illness can live better, productive lives. Treatment plans are tailored to the individual patient because people react to therapy and medication differently. So now we're going to be talking about psychotherapy, also called talk therapy. Psychotherapy is the best option for some patients. There are a number of psychotherapy techniques to help patients identify and modify thoughts, behaviors, and emotions with the help of a trained and licensed professional. The two most popular forms of psychotherapy are psychodynamic therapy and cognitive behavior therapy, according to Harvard Medical School. Now, with psychodynamic therapy, focuses on how current and past relationships, life events, and desires affect the choices you make and how you feel. The theory is that people create thought patterns and behaviors to protect themselves from traumatic experiences or external threats. A therapist can help people identify these thought patterns and behaviors and help develop strategies to cope and overcome them. For example, someone with overbearing parents may have difficulty developing intimate relationships because they are afraid of being controlled. This type of therapy can also help improve social interaction. A type of psychodynamic therapy called interpersonal therapy blends psychodynamic and cognitive behavior therapy to help people deal with relationships and teach better ways to communicate with others. Now we're going to be dealing with cognitive behavioral therapy or CBT. In contrast to psychodynamic therapy, cognitive behavior therapy focuses less on feeling. Instead, it teaches people how to recognize behavior and thought patterns that are causing problems. Then it teaches techniques to change these patterns. The theory is that people can change feelings by changing thoughts and actions. People have used CBT to treat smoking, phobias, procrastination, and help symptoms of that, like depression and anxiety. For example, people who have distorted thinking patterns, such as always thinking the worst, excessive guilt or self-criticism, or people thinking people view them negatively. CBT therapists help these people recognize these patterns and change them. CBT helps people develop more positive and productive responses to distress, such as breathing deeply to relax instead of hyperventilating during stressful situations. Now, there's also prescription drugs, which can help you to deal with these mental health illnesses. Okay, according to a 2017 research letter published by the journal JAMA Internal Medicine, 1 in 6 Americans took a psychiatric medicine in 2013. Often, healthcare providers will use medication as the first line of therapy for mental illness, but these people should ask healthcare providers if psychotherapy might be effective enough without medication. Depending on the type of mental illness, healthcare providers may prescribe a specific type of drug because people respond to medication differently. Finding the proper medication and doses is often trial and error. Sometimes a healthcare provider may prescribe more than one medication. It is important for people to be patient and communicate their feelings, and if they have experienced side effects to the healthcare provider. Each drug has its own side effects, and the patient and the healthcare provider needs to weigh the risk and the benefits of each medication. Some medications for mental illness may be habit-forming. They include stimulants and benzodiazepines. They are considered problematic for long-term use and no longer recommended for first-line treatment of anxiety. Excuse me. I just have to move my position. Basically, I'm sitting down, so sometimes I have to move a little bit. So now we're going to be talking about medications for depression and anxiety. Medications for anxiety and depression are similar The drugs are designed to balance some of the natural chemicals in the brain. The classes of antidepressants include selective serotonin reuptake inhibitors, monoamine oxidase inhibitors, atypical antidepressants, and tricyclic antidepressants are the most popular type. They work by increasing the level of serotonin in the brain. Serotonin plays a role in the mood. So now I'm going to be talking about medications for bipolar disorder and schizophrenia. Medications for bipolar and schizophrenia are called antipsychotics. Antipsychotics are used to treat conditions that involve psychosis. Psychosis involves a disconnection with reality. These drugs relieve symptoms, but are not cures. Older antipsychotics are referred to as typical antipsychotics or neuroleptics. Newer antipsychotics are called atypical antipsychotics. Okay, try saying that 3 times. Both these antipsychotics work to treat symptoms of schizophrenia and mania. Long-term use of older antipsychotics may cause potential incurable nerve condition called tardive dyskinesia. These conditions involve uncontrolled muscle movements, often around the mouth. Drugs called mood stabilizers are used to treat bipolar disorders and mood swings. Lithium is a well-known mood stabilizer. The U.S. Food and Drug Administration approved it for treatment of mania and bipolar disorder. Most the stabilizers work by decreasing the abnormal activity in the brain. Now, there's some other descriptions, which I'm not going to read because I can't. Okay. Now, I'm going to be talking about the safety. And again, if anyone wishes to join the panel, the link has been pinned. And anyone wants me, and in the comments, they can do so. After this, I'm just going to call this a night. Okay. So now I'm going to be talking about safety using psychiatric medications. Experts advise doctors they should prescribe medications at the lowest effective dose. They should continue to monitor their patients to determine whether the drugs are still needed. Researchers have found many patients are given long-term prescription for drugs that are recommended for only short-term use. Doctors and patients should work together on safely discontinued drugs. Sudden halting of a psychiatric drug can be dangerous. Patients should also discuss possible interactions with other medications, such as supplements and Wells food. They should avoid mixing prescription drugs and with alcohol and other substances. Sometimes a doctor may prescribe a medication for use other than what it is approved by the FDA. This is known as off-label prescribing. Patients should inquire if their drugs are being given for approved uses. If not, the doctor and the patient should be clear about the limits of research supporting the prescription of the patient's circumstances. Also, when patients take genetic medication, they should realize they're not exactly the same as name brand drugs. They may have different inactive ingredients such as fillers and binders. However, generic drugs are required to have the same active ingredient strength and route of administration and dosage form as name brand drugs and must be manufactured under the same strict standards. Now, there is some side effects that has to do with this medication. Okay, so what I'm going to do is I'm going to share with you what are the most common side effects. Sleepiness, nightmares, dizziness, drowsiness, dry mouth, nervousness, headaches, shakiness, confusion, weight gain, nausea, diarrhea, or upset stomach, uh, or sexual problems. I guess it has to do with the inability to gain an erection, I think. I'm speculating at this point. Now, there are other treatments. Okay. In addition to prescription drugs, patients have the option of exploring other kinds of treatments. They include brain stimulation, and complementary or alternative medicine. Example of complementary treatments suggested by the National Alliance of Mental Illness include herbs and supplements and exercise, including yoga. These treatments may be helpful, but the National Alliance of Mental Health stresses that the FDA does not review or approve many of these treatments. The government agency that oversees these therapies is the National Center of Complementary and Integrated Health. People can visit this website and see what the current science says about the effectiveness for a particular complementary drug. Okay. So now we're going to discuss brain stimulation. Brain stimulation involves using electricity to directly activate or inhibit brain activity. This can involve electrodes implanted in the brain or placed on the scalp. Magnetic fields can also be applied to the head. These therapies can be helpful to patients who have mental disorders that don't respond with other kinds of treatment. The most commonly used of these is electroconvulsive therapy or ECT, once called electroshock therapy. ECT is used to treat severe depression that does not respond to therapy. It also may be useful in cases of bipolar disorder or schizophrenia. ECT involves the use of electrodes placed on the head of the patient under anesthesia. They pass the electric current through the brain. Research has found that ECT shows results more quickly than other forms of treatment. So now we're going to be talking about herbs and supplements. Various herbs and supplements are used to treat different mental conditions. For example, omega-3 fatty acids may help decrease the risk of developing chronic schizophrenia in young people who have a psychotic episode. Folic acid or vitamin B9 may be useful in the treatment of depression and schizophrenia. Okay. The next thing is exercise, yoga, and meditation. And here's a fact. Exercise can relieve mental illness and reduce some of the side effects of psychiatric medications. Mind and body treatment options include yoga, exercise, meditation, and Tai Chi. These activities can improve mood and relieve anxiety and other symptoms of mental illness. Exercises can also reduce side effects of many conventional psychiatric medicines such as weight gain and fatigue. Research has found the evidence that these activities may reduce symptoms of depression and anxiety. Experts theorize that yoga, for example, may have affect brain chemicals called neurotransmitters, booster levels of the chemicals like serotonin that make people feel good. The exercise may also reduce inflammation and has a positive effect on lipids in the body. Meditation involves sitting in a quiet place, focused on breathing or a specific chosen word, and letting distractions come and go without judgment. according to the National Center of Complementary and Integrative Medicine, such research suggests that medications may reduce symptoms of anxiety, depression, and insomnia. And we got a pocket here. Okay. Now, what I read to you is not an expensive background regarding mental illness. There are many articles and many resources. Okay. But what is my take in all this? That there are many types of mental illness. Okay. And there are many ways to deal with them, and many types of treatment that are available to deal with these individuals. Okay. Now, again, as I stated before, the key is to acknowledge that you need help. That's the key. Okay. Once you acknowledge that you have a problem and you are prepared to deal with it, then you can recover. Okay. And I am fortunate because I have recovered from many bouts of mental illness. Okay. So I've been talking for almost an hour. Okay. If there's anybody else that wants to enter a comment, you can do so. If anybody wishes to join the panel, you can do so. If no one joins the panel, if there's no other comments, I will start to wrap this up. Now, before I go, I do want to talk about what's going to be on tomorrow. Tomorrow's topic is going to be how to deal with grief. I did discuss this, I think it was last year. However, it's good to revisit it again because the fact of the matter is you do have people who are grieving the loss of loved ones, okay, whether it be a spouse, whether it be a parent, whether it be a child, and to be honest, the loss of a child, particularly a child that in their youth, it's a very hard pill to swallow. And if anybody lost their only child, that's even worse. Okay. I don't know how to deal with it. Okay. If I was put in that situation, the only thing I can do is seek therapy or seek a person that I can share my grief with. Yeah. Yeah, you know what? It's not talked about because unfortunately there's a stigma attached to mental illness. Yeah, there's a stigma. So, and particularly if you are a male, it's even worse. Okay? Because we are taught that men don't cry. We are taught to be rough and tough. Okay? However, when you think about some of the stuff men have gone through, okay, like fighting in a war, okay, or losing a loved one, whether it be a child or an adult or what have you. It's never easy. And at times we struggle to try to find the right words to deal with a person who's grieving. So we say such things like, he's in a bad place, or we question what they died of, or or say, or words we tell people to snap out of it. Okay. Grief does not have an expiration date. Sorrow does not have an expiration date. And this is something that all of us need to understand. Okay. So are we talking about it? I think it's going to be 8 o'clock, but I'll probably push it to 8:30 tomorrow. Okay. And on Friday, I'm going to be discussing, is male loneliness a serious issue? So we're going to be discussing, is it really an issue, and how can we address it? Okay. Because one thing we do try to do here on this platform is we try to come up with common sense solutions to the everyday problems. That's the reason why I'm here. Okay. I don't claim to be an expert on any subject other than myself. Okay. So being that no one is going to join the panel, I'm going to start to break it up. First of all, I just want to share a huge shout out to the people that appeared on the chat: Christina, Donamando, and Herbie. Okay. And I suspect that there might be maybe people who will catch it on the playback. And that's perfectly fine with me. Okay. But of course, all of you are more than welcome to enter a comment after the stream. So let's keep it respectable, okay? There's no reason to go negative. There's no reason to attack other people, okay? If you want to do it on your platforms, fine. Don't do it. Okay. Now, here's interesting. The Caribbean, Hispanic, and Caribbean in general are very hush-hush when it comes to mental health issues. Yes, that's true. Okay. Because if you actually admit like you have a mental illness, all of a sudden they assume that you're crazy, and all of a sudden they treat you like a child. Okay. And the fact of the matter is, people of any age can suffer with mental illness. So, in any case, I'm going to wrap this up, and I thank all of you for stopping by. And of course, I'm going to close with, well, before I close, I just want to remind everybody that going forward, I'm going to be live on Tuesday night, Wednesday night, and Friday night. Okay. Most likely it's going to be between 8 and 9, depending on what the situation calls for it. But in any case, I do appreciate all those who have supported the channel. A huge shout out to all of you. So I will ask my subscribers to please pass the word, encourage others to subscribe to the channel. It doesn't cost you anything, but it does help with the algorithm. So with that being said, this has been another episode of Uncommon Sense with Jose Negron. Wishing you all of you a good night. Take care and peace. Be strong.